Welcome back into WKYT as our noon news hour continues. It affects millions of people, and we're talking about diabetes, a real problem in Kentucky. Do you have it, or are you at risk?
Dr. Raymond Reynolds with the UK Barnstable Brown Diabetes Center, along with Penny Brooks of the American Heart Association, are here to talk more about it. Thank you all for being here today.
Thank you.
Appreciate it. Let's start with just a very broad general question, Dr. Reynolds. What is diabetes? What goes wrong?
So I think most people know that diabetes is a disease of high blood sugar because the pancreas is unable to make enough insulin to overcome some of the resistance, or it's just not able to make any insulin at all. And I think people may be aware of things like eye disease and kidney disease and nerve disease. Probably less well known is the fact that diabetes is associated with early accelerated heart disease, and that's what people die of.
And there are
So
two different types of diabetes. What's the difference there?
So type 1 is less common. This is what we used to call juvenile onset, juvenile diabetes, where the pancreas doesn't make any insulin and you have to have insulin to live. Type 2 is more common, and it's related to your genetics and your lifestyle and your weight, and if you sit too much and don't move. But there are other types. There's diabetes caused by drugs. There's diabetes caused by cystic fibrosis. So it's complex.
But you told us you're kind of known for little sermonettes. In other words, there are some ways to sort of take control to an extent.
It is really associated by, your lifestyle really affects how well you can control diabetes. If you tend to go to the produce section of the market and do your fruits and vegetables, or you tend to go through the drive-through and eat fast food, things like that are going to make a difference. If you tend to sit in front of the TV after you eat supper, your blood sugar is going to be higher, you're going to need more medication. So we always talk to people about trying to be active and eating a healthy diet and monitoring your blood sugar, and of course taking your medication as your doctor prescribes. Those things all help.
Penny, I think a lot of people are aware of other connections, but maybe not this connection between diabetes and heart disease.
No, that's very true. Actually, I was a little bit surprised that it was such a big factor in that people have heart attacks, and also if it goes untreated, that stroke is very likely to happen, among other serious conditions.
The Heart Association provides information about all kinds of risk factors, and now this is, as we say, known to be one of those as well. Huh?
Yes, it is. We have lots of information on our website. We actually have a free patient support network that people can go on and learn more about. It's more or less a forum where you can go on and talk to other people. So if you're interested in that, you can go to heartdoc.org/diabetes.
For help in managing the disease then. Thank you all very much. Important information here in Kentucky. The rate is so high.
I appreciate it very much.